everyone! Let's just get into it. Nobody wants to talk about their tush. Think of an anal fissure like a paper cut. Tiny paper cut slice on a finger. It hurts way more than it should. That's basically what's happening, but in a less glamorous location. A small tear or crack in the super delicate skin of your anal canal, not a deep, cavernous wound, even if it feels that way when you sit. Just a little rip in the lining. The anoderm. It's one of the most common and least talked about problems, but it's so normal. Your butt has a tough job. It's the exit-only door for everything you've eaten. Sometimes the door gets dinged up. It's a mechanical injury, plain and simple. So you're probably sitting there, gingerly I assume, and asking the universe, why? What did I do to deserve this? I get it. It feels personal. But usually, the reason is pretty straightforward and, dare I say, boring. The #1 culprit of anal fissure causes is constipation and passing hard, dry stools. Imagine trying to push a giant, jagged rock through a very small, delicate tube. Something's gotta give, and unfortunately, it's the lining of your anal canal. It's a simple physics problem, really. Too much force, not enough flexibility, and voila, a tear. It's not just about being constipated, though. The opposite can also be the bad guy here. Think about chronic diarrhea. While it's not a big, hard object, the frequent, forceful, and acidic nature of diarrhea can also irritate and wear down that delicate skin, making it more prone to tearing. It's like scrubbing a silk blouse with a steel wool brush over and over again. Eventually, the fabric is going to give way. So, whether your digestive system is moving at the speed of a sloth or a cheetah, it can both lead you to the same unfortunate destination. Fissure Town. Population U. It's so unfair, right? Childbirth is another major player, and OMG, can we just talk about this for a second? Okay, so how do you know you have an anal fissure and not like a tiny ghost haunting your behind? The symptoms are pretty distinct and honestly they're hard to ignore. The main event, the headline act, is pain. But it's a very specific kind of pain. It's often described as a sharp, searing, tearing sensation during a bowel movement. Some people say it feels like passing broken glass. This is the initial ouch that makes you see stars and question all your life choices that led to this moment. It's a very dramatic, cannot be missed kind of pain. But the fun doesn't stop there. After the initial sharp pain, it often morphs into a different kind of misery. For many people, a deep, throbbing, burning ache can last for minutes or even hours after you've left the bathroom. Another telltale sign you might see is a little bit of blood. Don't panic. With an anal fissure, it's typically a small amount of bright red blood. The combination of that sharp pain during a bowel movement, the lingering ache, and a bit of bright red blood is the classic triad of symptoms for an anal fissure. Let's talk about the best-case scenario. Never getting one of these things in the first place. Prevention is your best friend. It's like, why deal with a terrible breakup when you can just not date the guy with a man bun who calls himself a vibe curator? The #1 golden rule of fissure prevention is to avoid constipation. This means you need to become besties with fiber. Think of fiber as the fluffy, soft pillow for your poop, making it easy to pass. You want lots of fruits, veggies, whole grains, and legumes. And water? Water is the slip and slide. It keeps everything moving smoothly. Seriously, hydrate like your life depends on it, or at least like your butt's comfort depends on it, because it does. Aim for at least 8 glasses of water a day, maybe more if you're active or it's hot, and don't fight the urge to go. When your body says it's time, it's time. Holding it in allows more water to be absorbed from the stool, turning it into a cement brick. So when you gotta go, you gotta go. Listen to your body. It's smarter than you think. Also, try not to strain or sit on the toilet for like 45 minutes scrolling through your phone. The toilet is for business, not for catching up on celebrity gossip. Dealing with an anal fissure can feel isolating and, frankly, super embarrassing. It's a health problem in a location we're taught not to talk about, so people suffer in silence. But I'm telling you, as a doctor and as a human being who appreciates a comfortable sitting experience, you have to break that silence. This is so much more common than you think. Your doctor has heard it all before, I promise. They are not going to gasp in horror or judge you, they're going to nod. They'll say, okay, classic fissure, and they'll help you make a plan. You are not the first, and you won't be the last. The good news, most fissures heal on their own with simple at-home care. More fiber, tons of water, Maybe some stool softeners, a warm bath, a sitz bath. That's the doctor term. Soak in warm water for 10 to 15 minutes. Do it a few times a day. It helps relax that spasming muscle. It increases blood flow. It promotes healing. It's basically a spa day for your butt. It deserves it after all it's been through. You are a strong, capable person. You can overcome anything, including a ridiculously painful tear in an inconvenient spot. Now, go drink a glass of water. Doctor's orders. Thanks for watching. Like, share, and subscribe to join our growing community of healthy humans. See you soon.